that time of the year. The rains are here, a natural blessing to the environment, providing greenery and cool climate that is soothing to the skin. The rainy season, also known as the monsoon season, is a favorite season for a lot of people. For others, it is their downtime, particularly for those with cold allergies and other underlying health conditions. Sweet as the season can be, it comes with a host of infectious diseases, notably a respiratory-related ailment such as cold and flu. The wet ambience it comes with also, if not properly handled, can create dampness and muddy environment that can lead to waterborne diseases like cholera, among others, especially among those with low immune system. This episode of Health Options promises to keep you abreast of some of the ailments that comes with the rainy season and prevention. As usual, we have something for you on Nature's Corner. Thanks for keeping a date with us. I am Salwa Khalil Ibrahim. When the rains pour, everyone wants to stay dry and keep warm, mostly as protection from cold-related allergies or associated infections. So, what are these ailments and how best can one stay afloat during the rainy season? We have a specialist in the house who will be answering these questions and guide us on healthy lifestyle for this season. Stay tuned. I'm now joined by Dr. Agbo Ebuta, a consultant and family physician. Thanks for coming on Health Options, Doctor.
Thank you. It's always a pleasure to be here.
Okay, now, medically, is the rainy season peculiar with ailments and diseases?
Yes, definitely. The rainy season is associated with a higher flow of water levels, and to a large extent, this has implication for the public health and the population health, and so it's important to beam our searchlight into that. And by way of looking at it critically, during the rainy season, you have an upsurge of what you call waterborne diseases. You also have an upsurge of water-associated vector-borne diseases, and I'll break it down. For waterborne diseases, for example, is mainly infections that are typically fecal-oral, meaning that they are associated with the indiscriminate public defecation and contamination of drinking water and food, which leads to symptoms like vomiting, abdominal pain, cramps, as the case may be, and diarrhea, most especially, which can be life-threatening. In fact, it is no surprise that conditions like cholera, salmonellosis, which is also nicknamed and popularly called typhoid, Campylobacter infections, and other gastrointestinal infections, that is infections that infect the intestines of the patient and give symptoms associated with that, like I pointed out earlier, vomiting and diarrhea, which can be life-threatening. So this happens mainly because water source is contaminated, and it's typical because during the rainy season, for example, high flow of water means that all those barriers that we have set up to protect the collection point of feces, for example, is broken down. And where you have mini floods and all of that, these mini floods will carry feces from where they are supposed, where it was artificially constructed to be like a repository, to areas where they contaminate vegetables, they contaminate surface water, and our dear people, 230 million Nigerians in search of water, may now go and get water from some of those sources and become infected. So you have patients. So we are not surprised that presently we have an upsurge of cholera cases.
Yeah, like really, we're seeing in parts of the country now.
Yes.
But I know most commonly people will associate the weather with cold and flu. When people have catarrh, cough, sometimes people say, is that time of the season again, It's one of the most common ailments among cholera, like you mentioned, we see during this season. So is that also peculiar to the raining season?
Yeah, indeed. During the rainy seasons, the temperatures are much colder. And because temperatures are much colder, the natural UV light sterilization of bacteria and viruses especially is not as much. So when you have the sun out there, the sun, apart from whatever it does for all the things it does for us rather, it also serves as a sterilizer to many microorganisms that we may not even see. So during the cold weather and you don't have high temperatures, most times the temperatures are cool and you don't have as much sun as you typically will have, that natural UV light sterilization is reduced. So it means that viral loads on hands and for transmission in the public space is much, much higher. Apart from that, it's also clear and is known that cases of influenza, upper respiratory tract infection are typically higher, especially in climates like ours, the tropics, where you have seasons divided into dry and rainy season. And we do know that the rainy season is typically between March or May to as far as October and towards November, as the case may be. So yes, indeed, upper respiratory tract infection, principally as a result of viral contamination or viral contact with viral infections like parainfluenza virus, influenza virus, ecovirus, coronavirus, and a lot of other viruses are responsible for an upsurge of upper respiratory tract infection during that period.
Now, as a specialist now, I would like to ask, do we see more often outbreaks of diseases during the rainy season as compared to when the weather is dry?
Well, not necessarily. You do have two classes of diseases, generally speaking. So you do have a first class, which is called non-communicable diseases. And I'll just mention it just to do away with it. Non-communicable diseases are hypertension, diabetes. These are diseases that cannot be transmitted. They are usually lifestyle-related diseases due to sedentariness, excess salt intake, inherited predispositions, and the rest. So these diseases will not vary during a change of season. However, the other class, which is communicable diseases, some patterns, some classes, some subgroups of communicable diseases, as we are discussing, are higher during the rainy season than in the dry season, mainly because the enabling environmental factors are in place. So you can see that during the rainy season, for example, because of more sources of breeding sites, mosquitoes can multiply.
Is that to say more malaria?
Absolutely. So malaria cases are usually higher because the vectors of that parasite of that is also high. The protozoa, the vector of the protozoa is high. And apart from malaria, other low-grade infections that are transmitted by mosquitoes are also experiencing a spike. Things like dengue fever, things like yellow fever. These are other conditions that are transmitted by malaria, by mosquito rather, and they are also a spike. In fact, we know, for example, that malaria prevalence can increase by as much as 50% during the rainy season.
Wow.
In the FCT, we have a prevalence based on estimate that about 22.5% of the FCC population averagely would have malaria. We know that this number goes up a little more during the rainy season because we have more mosquitoes flying around, and the more mosquitoes you have, the more people are bitten, the more transmission.
But I want you to re-emphasize now with those with underlying conditions, for example, those with sickle cell anemia, or those with other underlying ailments.
Yes.
Do they see more crisis? Asthmatic patients?
Yes, indeed. The sickle cell anemic patient have a higher degree of cases. Now, I can explain that very clearly because there are several factors at play. Number one of the key causes of increased crisis in sickle cell anemic patients is increased malaria prevalence. So we have already discussed that. Malaria prevalence goes up, chances of crisis goes up. But number two is that during the rainy season, the whole temperature, atmospheric temperature, environmental temperature are much lower. And low temperature in sickle cell anemic patient is not the best. It increases the chance that the sickle cell, the cell, which will be pre-sickled, it will now sickle. And you know, when these red cells become sickle, what happens is that they lose their flexibility, clog up tiny little vessels where blood should flow, and creates problem, which is basically the bone crisis. So yes, indeed. And the other hand, of course, asthma cases typically are also high because during the season, the rainy season, for example, cases of upper respiratory tract infections are higher. So once you have an adjustment in the natural protective mechanism in the upper respiratory tract, the chances that the patient will have recurrent episodes of respiratory compromise, like asthma, exacerbation of what we call chronic obstructive airway disease. So usually during the period, patients who have an adjusted, downwardly calibrated immunity of their respiratory system have a higher chance of having those reoccurrence.
Okay, many thanks, Dr. Agbo. Now, we'll take a break now. When we come back, we'll talk about the management and how to keep afloat during the weather. Stay with us.
Kuka that's the name in Hausa.
And that is call it Oshe.
In Yoruba.
Oshe, Igi Oshe.
Okay, so I know it's Kuka.
I am delighted to have you join us on Health Options, the program that not only tracks government policies on health.
The total cholesterol is made up of some components. The high density lipoprotein, which is the good cholesterol, the low density hypoprotein, which is the bad.
Cervical cancer, a type of cancer that develops in a woman's cervix.
There were opportunities for women to get screened for both cervical and breast cancer, maybe up to 30,000, but we'll be having figures of 5,000.
If you just joined us, the program is Health Options on the NTA, and we've been talking about ailments associated with the rainy season. And my guest is a consultant family physician, Dr. Agbo Ebuta. Many thanks for being there, Doctor.
Thank you.
Okay. Now, we've spoken a lot about the ailment associated with the raining season, you know, malaria, those with underlying ailment, cholera, like we have it in parts of the country now. Now, what are those major tips now you can say one can do to at least avoid being infected, or those that are infected, you know, to manage themselves?
To reduce respiratory infection, we can just cast our minds back to what we had to put in place when we had the COVID pandemic. So what do? You wash your hands. You avoid using your hands to touch your face. You sanitize your hands whenever you come in contact or you're in a public place. And you avoid crowded places, especially when you suspect that other people there may have respiratory tract infections. If you have a downgraded or a immune system when it comes to the respiratory system, you need to know that you need to present early when you notice any symptom, so that you can nip in the bud any far-reaching or high implication compromise of the respiratory system. That's on one side. On the other side, obviously, for things like malaria and vector-borne diseases, which are generally higher, it's very important to put in place measures that control malaria breeding around your environment, cutting grasses, making sure there is no puddle of water, open containers where malaria or mosquitoes rather can breed. And of course, netting your house will reduce mosquito transmission by as much as 54% range based on study findings. In addition to that, of course, in patients who have sickle cell anemia, as we pointed out earlier, it's important that they take their malaria preventive medication, which has been shown to reduce malaria transmission or malaria events and need for presentation in hospital by as much as 40 to 60%. So these are all critical. Again, for food and waterborne diseases, food hygiene is critical and important. Starting from, you can't go about buying fruits from from people who may not be licensed or may not have, you may not think they have the without knowledge and capacity to produce and provide safe sources of fruit. That is one. But even if you decide to buy fruits from the public place, it's important that you wash them up properly before eating them. Wash them up before bringing them into your house. And then when it comes to water, you must be vigilant. Drinking water is a major contributing factor to gastrointestinal infections like cholera, typhoid, campylobacter, and a lot of others. So you must ensure that your source of water is safe. Boil water where necessary, filter it, cool, and drink. In fact, when you boil water, you have eliminated all possibilities of bacterial infections which are responsible for most diarrhea. Cholera cannot exist in boiled water to a large extent. So that should be put in place. But again, if all of these fail and you develop symptoms, you need to understand that even conditions like cholera can lead to waste, loss of water as much as 20 liters in a day, which can kill. So early presentation in accredited health facility is critical and important.
Okay, I would like to take us back a little, not back per se, but there is a general argument that cold and catarrh is not really associated with the raining season. Now, I want you to clarify that. And is it contagious?
Well, cold and catarrh is a general term for symptoms associated with sneezing, nasal discharge, and maybe cough. Now, some of these symptoms may not be infective. However, for the ones that are infective, that is due to an infection from contact with a possible source, it is typically as a result of viral infection. And most studies have come to a conclusion that during the cold weather, this risk is higher. And of course, we know, for example, that there are several factors that are at play. It's not necessarily that, okay, during the rainy season or cold weather, it must go up. But there are factors that are in place that have increased the prevalence of this condition. And like I pointed out earlier, to a large extent, the chances of transmissions are higher in cold weather. The chances of viral death for viral atmospheric sterilization are actually less in cold weather. The chances that people crowd together are higher in cold weather. And all of these factors come into play when you talk of transmission from the public health point of view.
Okay, now on a final note now, how can one, protect oneself from the weather? I know the weather these days is unpredictable now, and then sometimes one cannot help it being cold, and so when you're always out and about. Now, what do you do in that case? Well, from the health point of view now.
From the health point of view, well, first we must thank God our weathers are not as extreme, like too cold when you travel to Europe or Canada, or too hot when you go to the Middle East. But indeed, we do have fluctuations of weather. You can cover yourself properly in the cold weather. Dress to the weather. It's important that you can access online sources of weather forecasts, which I have found very interestingly useful, that you can forecast the weather, temperatures, raining for the day, or other weather patterns for the day. But you should be well prepared to go out. I don't think it's a nice idea to run around under the rain. That can lead to problems health-wise, in terms of, especially for sickle cell anemic patients, people with respiratory compromise. So overall, you should be well kitted for the weather. Thick clothing for cold weather, light clothing for hot weather, and then well covered to a large extent. I believe that should.
Hot drinks? I didn't hear you say that.
Oh, yeah. Well, the thing about hot drinks is that hot drinks can help soothe the throat and keep you warm. Taking teas would these may not have any medical implication. Okay. But they just have a comforting implication. Okay. Yes, because even if your temperature goes really down, taking a cup or two of tea is not really going to reverse whatever kind of damage. Oh, wow. You certainly would feel better, and of course for companionship and the whole general benefit of taking a cup of warm tea and the satisfaction that comes with it. Yeah.
Okay, thank you very much, Dr. Abel, for coming on Health Options.
It's a pleasure to be here and looking forward to more engagements.
Thank you, and hope this advice helps you get over the weather. Now, do you already have a runny nose, or are you coughing or generally under the weather? Here are some natural home remedies from our Nature's Corner.
For flu and catarrh, in your environment, you can get a lot of remedy that can protect you from even contacting flu and catarrh, and as well some allergy that can lead to flu and catarrh. For those who have their lemon at their backyard, this is a very good remedy. This can also help you. You can just have it in your bottle of water. You can be sipping much of water. When you have much rainfall and so on, make sure you're always hydrated too, because when you get dehydrated, it affects virtually all the thyroids or even the vocal lobe, where you can not speak much. You start losing your voice. You can cut it into two, then you put it in your bottle water. You can be sipping it, or you make sure the bottle water is a bit cool warm. Yes, when it's a bit warm, it's more better preferable. And with this, the lemon also helps in terms of detoxification as well. It can help you in terms of detoxification, detoxify the lungs and so many things in the body. Then also, the lemon has a lot of nutrient and component inside that can help you to boost your immune system. It helps you in terms of your immune system that can go against minor, or let me say little bacteria that still flies when we have a condition of our rainfalls and other weather. So the climatic condition can lead to a lot of things that we have to consider in terms of our health status. Whenever we are having such climatic condition, the first thing you do is you have to make sure you change your lifestyle. You have to change the type of food we eat, and we have to change the spices we also eat. Yes, with the spices, we have a lot of things that you can mix in your, for those who are good in pepper soup. You have to spice it up with so many things this time around. There is a clove. This clove you are seeing, the red clove, is very good. Is more like antibiotic. Yes. In nature, it's more of antibiotic. It has a lot of components and also some antibacterials that takes care of all those kind of small infections that come through flu and cold and catarrh. So it can help you with this clove. You boil your water with the clove and also sip it. You make it like your tea. You can add honey. Adding the honey, it will give you a very good syrup that has to do with cough syrup. Yes, with this you are good to go. You are against the cough. Cough cannot just come in anyhow. It's a very good antibiotic when it comes to any respiratory organs infections. Lemongrass, this is common in most of our environments. You can boil it on its own. Just the juice. You can even apply the juice on your legs where you have your aches like rheumatism, arthritis. It also helps for it. And we can also use it together with turmeric. You boil it together with turmeric. It's good to go like your tea. And as well, you can boil it with the clove and the ginger and also with the lemongrass. This is very, very good. And you can make sure once you boil it finish, make sure you sip the water. For those who have it like a fever, the catarrh is coming up like fever. Yes, and maybe the chest is already highly congested, it's heavy already, you can't even breathe the way you are supposed to breathe and so on. Once you have that steam bath and you take the inhaling of the heat in, within 3 minutes you'll feel free.
Now, Nature's Corner concludes this week's episode of the program. But if you miss any part of this, no worries, as you can always catch up on these and previous episodes of the program at www.nta.gov.ng. We also look forward to your questions, comments, and suggestions. Thanks for watching, and bye for now.